Welcome you all to the India Edison Accelerator Demo Day. I'm Anirvan Chatterjee, and with Gaurav Srivastava and Professor Kiran, we are co-founders of HaystackAnalytics. Having seen the impact of genomics close up in places like University of Oxford and having created tech-enabled businesses globally, we have joined hands towards democratizing genomics and enabling healthcare providers to administer the right treatment to the right patient at the right time. Our mission is to prevent every avoidable death with a timely and accurate diagnosis. As humans, one of our strengths is that we can adapt and move on. Unfortunately, this also comes back to hurt us badly from time to time. Case in point are infectious diseases. Think of fever. Even while most of us get it for a few days, ever so often, it causes tremendous stress. And then there are those times a fever doesn't get resolved. And then all familiar discovery cycle of test and treat continues till one lands up in the ICU. Worse still, one is admitted to the hospital for a certain condition which then turns into an infection. Sepsis, or bloodstream infection, is the condition where an infection has spread to the body, and then it's a race against time. Globally, more than 40% of ICU deaths happen due to sepsis. Despite the fact that antibiotics have existed for more than 50 years and that there are several tests aimed to identify the cause of the fever, more than 49 million cases of known sepsis occur each year globally, and 11 million deaths are attributed to sepsis. Here are two typical cases. One of a cancer patient who is hospitalized due to fever and who rapidly deteriorates to sepsis. And then there is a patient who has a fever of unknown origin while at home and then is admitted to the ICU within a week because all therapies had failed to resolve the fever. Both the patients were admitted to possibly two of the best private hospitals in India, one in Mumbai and another in Bangalore. Both of them had been tested using the best standard of care, including culture and rapid molecular tests. Yet, all the tests had failed to identify the causative pathogen. It seemed both of them were heading towards a direction which will leave their families with a thought, should we have tried a different hospital? But this time, Haystack worked closely with the doctors and the hospitals. We were able to put a report on the doctor's table which armed them with a previously unthinkable arsenal, a genomic diagnostic report. Genomics, it is the same technology today which is used to measure the performance of RT-PCRs and cultures. Genomics, which we did directly on blood. Universal ID, as developed by HaystackAnalytics, is world's first genomics-based, fully automated product which can be integrated into any molecular diagnostic lab with no skill upgrade. With our team's 40+ years of combined experience from some of the world's best research and diagnostic labs, we have given the healthcare system the power to use genome sequencing in decoding the entire genome of a pathogen and determine the right therapy in a matter of hours and not days. Today, with our platform integrated into the Edison platform, we have created genomic diagnostic delivery compliant with the global data security and privacy standards, all of this deployable in any hospital. For sepsis, a test must be comprehensive and must be able to give a report within hours. Today's tests deliver neither. Culture tests are archaic, unscalable, and unreliable. Molecular tests promise a lot, deliver much lesser. Universal ID is a culture-free targeted genomics workflow which yields results in less than 15 hours and can already detect all bacterial and fungal pathogens known to cause sepsis and can also detect the presence of antibiotic resistance genes. Like every other genomic test, Universal ID can be trivially expanded to include more targets. In our blinded study, we have achieved an accuracy of greater than 99% with culture, the current standard of care. We are now launching Universal ID with our partners in some of India's most reputed hospitals and medical colleges. As we take universal ID to the hospital near and far, our team is now working hard to validate and introduce several genomic applications addressing chronic conditions like hypertension, diabetes, and heart health, and critical conditions like stroke, rare diseases, and neurologies. The world's best scientists have been using genomics to solve healthcare's toughest problems for the past 20 years. HaystackAnalytics is bringing that science with modern-day compute to enable genomics on the table of every healthcare stakeholder, enabling them to save more lives than ever before, faster and better. Thank you for your time. We are looking to work with partners who have the same intent for making healthcare more transparent and better.